Hi, my name's Holly and I'm from Brinsea Products Limited. Today I'm going to be talking you through the setup of one of our TM units. Today I have a T40M. The setup is exactly the same with a T50M, it's just a size difference. So before we start, an important note is that these units should only be used under the guidance of a medical professional for animal treatment. Once you unpack the unit, make sure that all the packaging has been removed. In the product manual, you'll find a list of the parts you need for this setup. Okay, so now we're going to go through the assembly of the unit. First of all, we start with the top of the unit and you want to fit the bracket for the door to start with. So you're using the 2 washers and 2 dome nuts. And the shorter screws that are supplied. Okay, so once that's fastened, you're next going to bring the bottom of the base and the door. So the door slots in here, like so, and you want to make sure it's fastened. Then we bring the base and the top together, so you've got the top of the unit slotting over, and then just make sure those fit together like so. Okay, so once you've got the base firmly in place and you've checked the door, we're then going to go round the unit with the washers and the nuts and screws. So you should have 12 of these. And what you want to do is fit them by hand firstly, and then using the tools provided, we're just going to tighten them. You don't want them too tight, you just want them tight enough so that it's firm and the screws don't spin. The cabinet doors can be adjusted like so to minimise the gap on the side of the door. This is done by adjusting the screws at the top and bottom and fitting a grommet strip. So once you have all of the nuts and screws in place, you'll do 11 all the way round, and then the last one we have where the nebulizer solution holder will go. So this is the bracket for it, and you're just going to fit it, hold it in place, and then just again use the rest of the kit to fasten it up. Now we have fitted the nebulizer solution holder bracket to the unit, we're now going to put together the solution holder itself. So this is how it comes. You just want to pop that in there, and then the tubing on the bottom there. This then slots into the machine, and you just want to give it a little push so it's nice and secure in the bracket. And then this end will fit into a nebulizer solution pump. This isn't supplied with the unit but can be supplied by a veterinary equipment supplier or distributor. So next I'm going to show you inside the unit, and we have a water pan or reservoir which sits just at the back here. This can just slide out, and in there you have an evaporation block. So with this, you want to fill it up so that it sits in there nicely. It's actually a lot easier to fit this once the sponge is slightly damp as well. So you're going to Fill this up either by sliding it out and popping some water in the bottom, or you can use the funnel provided, which just goes in the top here, and then you would just slot it in and use a jug or something to prevent too much spillage to fill up the evaporation block. We have that in there because when the temperature rises in the unit, it can cause the relative humidity to drop inside the unit, which may then cause dehydration. So it's important to make sure that you're using the evaporation block and the water pan with a bit of water in there. This can be used during oxygen therapy as well. And also to increase the humidity levels even more, there is a humidity pump as well that can be attached, and I will go through that in a moment. So next we're going to fit the oxygen connector. This comes like this, and you just want to unscrew it like so, and then this will then go onto the top of the unit. So the connector sits in the top there, and then on the inside you can remove the water pan and reservoir. And once the connector's secure, you can fill up the reservoir with some water and pop that back inside. Okay, so once you have connected your oxygen connector to the unit, you then are ready to connect it to your oxygen supply, and this can be done via some tubing. This generally is already in veterinary practice, or you can order it from a veterinary equipment supplier. It doesn't come with the unit. And just to make sure it is fastened, I've got some tubing here just to show you. You would pop this on the top here, and you can use a clamp just to make sure that it's secure at the top. It's important to mention that when using oxygen, the nebulizer solution pump cannot be used, or a humidity pump. These need to be disconnected from any electrical source. If needing to nebulize the patient, pop medication into the solution holder and pop into the unit. Connect up the tubing and push into place. The other end will then connect to a pump. This doesn't come with the unit but has a universal fitting. If you don't have one, this can be ordered through your veterinary supplier. For cases when you need a humidity pump, these are ordered separately, and they come with the tubing and the connectors separate, so you would just need to fit them like so, and there is a diagram in the manual to show you how to do this. There is also on the front of it a little diagram there on how it should sit. And then the power supply connects to the front of the unit, just here. And it comes with the tubing. The tubing sits in the water pan inside the main chamber. We've given you more than enough, but you may want to cut it down so there's not as much, as you only need a little bit to go just inside the unit. Once the unit has been assembled, you now need to familiarise yourself with the control and alarm system operation section of the manual. Please then refer to the startup check sheet, which must be completed before each use to ensure the safety of the operator and the animal. We would advise to keep this by the machine for ease. The first 13 steps confirm it is in the correct condition and location. Then the control system alarm and safety system alarms can be tested using the manual. To apply power, press start. Then follow the instructions to complete the tests. Once it's complete, it is safe to use for general therapy. There are additional checks for oxygen therapy usage. Your unit is now ready for use, and the manual will guide you on how to set up for each individual patient. When it is time to switch off the unit, this is done via the mains, not the control panel, for extra safety measures. We also have a backup battery. This is in case of any power cuts, and this goes just into the back of the unit here. So you just have to lift it up and pull it out, and then that sits in there like so. Thank you very much for watching this video. Please make sure you go onto our website if you have any questions. We do have a frequently asked questions section on there. Also, you need to make sure you read the product manual carefully before using it. In the product manual, you can find the instructions for the assembly and how to maintain and operate your Vetario. We do also have a 3-year comprehensive guarantee, so please make sure you register this online with us as well to be covered.